if I can get this. I wanted to start with a little quote before we get going. And while you're digesting this, I want to thank the Planning Committee for giving me this opportunity to talk about something that I'm really am passionate about. We've heard so much today about the importance of data, the importance of making sure that data is, you know, inclusive, it's equitable, it's accessible. And I'm going to pivot from that a little bit. That is also very, very important. But what I want to talk about is, okay, we've got data, so let's talk about privacy. Let's talk about the people that are involved. And that's where we're going to come through for today. And if any of you folks are into cozy mysteries, which is my level, I mean, if you read legislation all the time, you would read this stuff too. Okay, so this is Alexander McCall Smith. And I just love this quote because it's so simplistic. And it's like, when you look at it, it's the secrecy about the self may seem ridiculous or unjustified. What matters to me and my privacy, to you might think, oh my word. But you know what? That's the way it is. Privacy is what it is to you. And that's where we're going to go today. So I also need to acknowledge the land on which I work and where I live. And I'm from New Brunswick, and where the University of New Brunswick is located, it is located on the Wolastoqey land. And I'm looking at my notes because I want to make sure I pronounce it correctly. And it's the land of the Wabanaki people. And this is unceded, this territory that we are on, unsurrendered. And it was shared through recognized series of peace and friendship treaties. And what's really amazing about this land that we are able to work on and where I live, and my neighbors are the Sistanskik Nation, is that there's a river that runs through our entire community, and that's often called the St. John River, but as we're realizing, it's also the Wolastoqey River, and that's really important to recognize that, and it brings our communities together. So what we're going to do is we're going to talk about privacy. What is meant by privacy? I'm telling you right now, it's going to be hard to define. Someone said this morning in one of the talks, and I really liked it, it's about concepts. Some of these terms we're talking about, there's no like nice, neat, and tidy definition. We're going to talk about personal information, defining personal information. I just said define, whoops. Okay, we'll just skip right along there. Protecting privacy, data privacy. This is completely a typo. You know what kind of wild ride we're in for right now. This should say data privacy, how it is governed. We won't even go there. And health research, and really pulling it back to the use of personal health information in research and how it is protected. So let's start with privacy. Now, I was promised that we would have some clouds. Do I get my clouds, my word clouds? Does anybody have word clouds for me? Da, 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 da. Can I get a thumbs up or something on my word clouds? Anybody? Oh. Ooh, okay. So the first word cloud that we're going to try here is, what does privacy mean to you? In one word or two. Like just, oh. It was too quick. You got the QR code there? So just, how would you define privacy? Let's pause for a second here. Oh, personal, that's good. I like that, voluntary. Security. Infirmary, I don't know that one. Information, okay, spell check. Secure, personal. Comfort, oh, I like that. Control, protected. This is excellent. This is great. Maybe just a couple more. I see two people. Control. Story. Transparent. Confidentiality. Somebody saw my slides. Okay. Voluntary. Restricted. Oh, these are excellent. Okay. A little bit of a pause there. Okay. Maybe I'll Identifying, ooh, foundational to freedom. You saw my slides. Okay, let's pause it at that. Really great. So folks who are manning things back there, I can advance to the next slide. So what is privacy? Those were excellent points because, like I said, it comes from what it means to you. And one of the key concepts around privacy is that it is a human right. And that's what it all comes back to. If you look at the Universal Declaration of Human Rights and Article 12, it talks about that no one shall be subjected to arbitrary interference. Unfortunately, they need to update the language a little bit with his privacy, family, home, or correspondence. But the point is here that you have that right of privacy. And I want to make sure that we're building on that right. It comes back to a right space. And this is really important because often one of the things I'm going to speak about a little bit later on are the mechanisms in place to protect privacy. And currently in Canada, our federal legislation is not rights-based. Okay, so that's really something to think about. When we're talking about privacy and we're trying to define, and I use that in those air quotes, is that really what happens is there's many, many definitions, and depending on what industry you come from and how you use data, you might define it slightly differently. But what's often common is that self-determination, that ability for self to say, to have that control over your own information. And that's what's key. So regardless of what definition you land on, what working definition that helps you do your work that you need to do, it's that claim and right of individuals that we always want to come back to. And the next thing that I want to talk about when we're talking about privacy and trying to define it are the types of privacy. And you probably know these and you don't even call them these things. And so the first is communication privacy. We get this, we have our text messages and we have our phone calls and we have that, all of that, we have a right to our own personal information when we're communicating to others through those kind of different medias, through the mail. Remember post kind of thing? So, sending a postcard was always fun because you got to read it, kind of thing as your sister's postcards came in. Jeanette, don't listen to that. So, okay. But then there's also spatial and individual privacy. We understand the privacy around ourselves, and we get this as well. This would be our homes. This is your workspace, your desk, how you like to keep your cubicle. And we all understand that if you've ever had your car broken into, that feeling of like somebody's been in your space. I mean, my car, there's nothing fancy about my car, but it's my space, so those are the things that we understand, that kind of privacy. And the privacy that we're really talking about today is our information privacy. And so this is the privacy that's concerned with anything that holds information about us. And so let's talk broadly here because we're going to be talking about data and research, but this is information. This is like your credit card information. This is your Netflix account information. All of that, your information privacy and how that needs to be protected. And confidentiality, and the reason I stuck this in here as well, and someone mentioned it in the word cloud, which I'm glad they did, is because when we think of privacy, we think of it as a right. We need to think of confidentiality as how we get to there. It's the series of procedures and practices that we follow. And a great definition of that actually comes from the Tri-Council. Oops, that didn't come up there. It's an ethical and/or legal responsibility of individuals or organizations to safeguard information entrusted to them. And so this is a series of, it's about trust. It's the obligations that we have when we're dealing with personal information. It's a set of rules we follow within our organizations around information, and just that ethical side of things. And if you're new to some of the conversation we're having today, we often talk about the Tri-Council. So just to elaborate on that, the Tri-Council is the body in Canada that makes up for the Canadian Institutes for Health Research, the Social Science and Humanities Research, I'm gonna get it, Research Council, and the National Science and Engineering Research Council, the three bodies that govern research in Canada. They provide guidance and direction, funding, and this is where we turn to for direction. So, alrighty. This is not the most cooperative little machine. Okay, so we've talked a little bit, just a very little bit. We've got some loose ideas around privacy. So why do we protect privacy? So this is our second word cloud. Why? Why protect privacy? I have heard so many times people say, I've got nothing to protect, I've never done anything, why does it matter? I don't care, everybody sees it on Facebook, it doesn't matter. Why does it matter? That's the question, yep, that's the question. Yeah, go ahead.
Yes, it can impact your employment.
Yes, absolutely. Employment, that was the answer from the floor, yep. Free to think, trust, big brother, prevent misuse, safety. Because Donna said so. Who from NBIRDT said that, Ted? So, a few more. We'll just take a few more here. Because there's people. Prevent harm. Safety. Prevent misuse. Really good. Yeah. Yeah. Prevention of harm. Sensitive and respect. Maybe just one more. Trust, prevent misuse. Racism and discrimination, excellent. Vulnerable persons. Yeah. This is great. These are really good. Okay. All right. Food for thought. And basically, I'm so pleased. So I'm going to go to the next slide now. Why protect privacy? Exactly the reasons you said. Exactly. Limiting power. You know, information is power, and we want empowerment over our own personal information. Control, having that ability to control. Who has control over us? Who has our information? We do. You know, that ability to change. Oh my goodness, I don't necessarily need you to know what I did when I was 16. You know, those kind of things. Like that ability. We change over time, right? We have privacy. Freedom of thought. We can vote with our conscience. We're so fortunate about that. Reputation management, like what does that mean? Like, you know, there's things, people judge each other, you know, and they judge each other unfairly. Privacy is something that can be protected. We maintain boundaries. What I share at work is not necessarily what I share at home. You know, we need to have that ability. Not having to justify every decision and everything we do, every behavior. We have that privacy. Our futures. We don't know what's going to happen with our personal information down the road, you know, kind of thing. So how we share it now is up to us, you know, kind of thing. Trust. Building trust relationships is so important. Think about when we want to speak to, maybe we want to speak to an elder, we want to speak to an imam, we want to speak to our doctor, our physician, our lawyer. We need to know that our privacy is going to be respected, you know, those kind of things. That political and social activities, we can participate in them with freedom. And the respect is really important, because if you don't respect my privacy, you're not respecting me as a person. And that's really, really important. So everything you guys said in your word cloud is pretty well we're all together on this. So how do we govern privacy in Canada? Like, how do we look after it? We say we need to, we recognize that we need to, and I have to tell you guys, that's like, I really do appreciate you participating in that, because if I had done that exercise even 5 years ago, I wouldn't have got much response, because people just weren't as aware about their privacy. So what we have in Canada is we have mechanisms and tools to help us protect. And the very foundational tool that we have are the Fair Information Principles. And what this is a set of 10 principles that are in place, and they dictate often what the backbone of legislation, best practices, and standards. And these fair information principles are not unique to Canada. They are globally recognized. You might go into another part of the world and they might be the 8 privacy principles or something, you know, but together they are recognized. And you know these, you do. There's accountability. Someone needs to be accountable. And whether that's yourself when you're working with someone's personal information, whether you're doing research work or whether you are just, you know, maybe you're interacting, providing a service to someone. You know, I'm thinking of the clerk at the HomeSense who's always asking me for my postal code. You know, you're accountable for protecting that personal information and assigning someone to be accountable. So my role that I have at the Institute, accountability is there, and it's not an excuse to say you didn't know you needed to protect personal information. Limiting collection, and this is something that Carrie Ann and Laura both mentioned. is limiting. You only collect what you need. What do you need to do the job? What is it that you're trying to accomplish? Don't collect any more. It goes back to my classic example. If the cookies aren't in the house, I'm not going to eat them. If the information is not there, you are not going to misuse it. It's not going to be, there's no risk of breach. You know, you only have what you need to have. Identifying purpose. You need a purpose. Accessing data, collecting data should never be just 'cause. You might want to. Maybe you're going to use it down the road. That's not a reason. You have to have a very specific purpose. Limiting use, disclosure, and retention follows up on the other last two points, and that means you're going to use it exactly for the purpose you said you were. You're going to disclose it in the way that you said you would. So if you say you're collecting personal information because you're going to be maybe putting together an invitation for this particular, for our event here today, right? Our personal information was collected, some of our, contact information. Well, they can't turn around and sell it to a third party, right? That just can't, that's not something you can do. So, and then accuracy. Oh, ladies, this is exactly what you were trying to say to us. It's so, so important that personal information is accurate, that it reflects folks, that it really is, and that there's mechanisms in place to correct inaccurate information. There's also consent. Extremely important. We're going to speak to that a little bit more, and that's informed consent. That's not implied by you want to get on to, we've all done it. We've all done it. We just want to get to the movie, so we click, right? And you haven't read what you've just clicked to. Safeguards, and safeguards we're really familiar with those. We often call them administrative, technical, or physical safeguards. That's what we're talking about. So an administrative safeguard might be a requirement for privacy training, or a physical safeguard might be to say that, the data is always locked in this particular, it's on this server in a locked room, in a locked office, that kind of thing. And then there's, I got excited. Then there's technical safeguards, and technical safeguards would be that multi-factor authentication, when you go to get into your bank account and then you get the little text message, all of those steps. So openness, extremely important. That ability that whoever's collecting your data, using your data, there has to be transparency. You need to know, you have a right to know what's going on with your data. And that leads to the right of individuals to access their data. They have a right to ask, what are you holding on me? What do you have about me? Where are you keeping it? How are you storing it? Those kind of questions need to be asked. And challenging compliance is the last of the principles. And this is that ability that there need to be mechanisms in place that if you have concerns, there's somewhere to go. And in in all of our provinces and territories in Canada, we have either an ombuds or a privacy officer or someone we can raise concerns with. And this isn't just, we're not just talking, I'm talking here, this is all personal information and personal health information. This isn't just unique to research work. So this is, if you take nothing home today, take this, that these principles apply to all your personal information. So another mechanism that we have, then I alluded to this, I said that those fair information principles provide the backbone, is for legislation, and this is laws and regulations that help provide us the guidance and have mechanisms in place to protect privacy. And there's international. So if you're doing any kind of particularly commercial trade, as we're talking here, okay, think about this hotel we're staying in. We've all booked into this hotel. Our personal information has been collected here. They would have to, if there's laws that have to be followed, right? There's the General Data Protection Regulation might be one, GDPR, people might have heard that. If you're doing any trade at all with the European Union, if you buy a sweater from someone in the European Union, they have to follow the GDPR. Okay, that's a requirement. In Canada, we have two main pieces of federal legislation, and again, Carrie Ann and Laura mentioned these. We have the Privacy Act. The Privacy Act, it applies to all of your personal and personal health information, when it's held by a federal body. And usually that's going to be to provide you with the service. That's going to be something like, it's going to be around the, like maybe I'm pausing here, you're old, I'm aging. It's going to be around your old age security pension. Whew, had a moment there. See, wasn't that a good time? So it can be your employment insurance, things like that. Anything of that data would have to follow the Privacy Act of Canada. And then the other piece of legislation you've probably heard of, and it was mentioned previously, is the PIPEDA, the Personal Information Protection and Electronics Document Act. Completely out of date. It needs to be refurbished. It's before in the federal House, before committee. I wait. So, but it applies to all businesses that are collecting personal information, and this is about around business transactions. So it does not apply to not-for-profits if there's no business going on. But what probably is of most interest to us today are the provincial and territorial pieces of legislation, because these speak to most commonly to the personal health information, because the health care has been deferred down to, in our system of state, to the provinces and territories. And so here we have sets of personal health information acts, and we'll have personal information, freedom, access to information, these kind of things. All of that legislation falls under provincial and territorial. What we cannot forget is that there is Indigenous data sovereignty. And this is under the United Nations Declaration on the Rights of the Indigenous Peoples, the UNDRIP, and we must recognize this. So all of this legislation is lovely, it serves a purpose, but Indigenous data sovereignty must hold. So then a third mechanism that we have in place are just policies. What I kind of grouped them under this title, policies and procedures. And what I wanted to point out here is that there are overarching policies that we just have to follow. There's things that if we want to, if we're out there and we're doing research, we're doing work, we're doing business. I have no idea what's happened to my slides, but the Tri-Council Policy Statement on Ethical Conduct for Research Involving Humans, this has to be followed if you're doing research in Canada. There's a Canadian digital charter that it provides guide rails if you're going to be using digital information that we need to follow. There's also standards and best practices. So the Standards Council of Canada, there's a Canadian Data Governance Standardization Collaborative that works together on standards around cybersecurity, around what does a privacy professional need for education and for credentials, like those kind of things. And then there's safeguards, like I spoke of earlier, that administrative, physical, and technical safeguards, that there are so many of these that are coming up all the time that we're understanding and learning about their capacity, ways of privacy-enhanced technologies, ways to protect information. Okay, so let's pivot a little bit. We've talked about privacy, we've talked about how the mechanism's in place, but what is it that we're protecting? What are we really talking about here? And we're talking about personal information and personal health information. And what I want to point out is, before we go any further into that, is that information or data, little bits of information that, those little points, it all has a life cycle. And we talked about the data research life cycle and what happens to the data during that life cycle. It always has a cycle. And what that means is, just like ourselves, there's a point of collection, there's a beginning and an end. And there's a point where I have here the word dispose, or, the end point, what happens at the end of it. So during that information life cycle, what's happening? All of those things, those safeguards have to be in place, those fair information principles, those pieces of legislation, they will always speak to collection, access, use, how it's shared or disclosed to someone else, to another party. It always comes back to this, and so we can't lose sight of this wheel. So even if you think the collection part is working well, how does, oh, my goodness, okay, speeding right along. Okay, so I'm going to go through this really fast. So what I wanted to say here is that the definitions you will find in legislation are all over the place, but they will always come back to some core. Every piece of legislation will define personal health information and personal information, and they will always have these same elements. And I won't read them because we're short on time. Apparently we got excited on those other parts. So I do want to point out to everybody that you'll see here that part of personal information, we've got, fingerprints, blood type, and heritable characteristics. If you only see the word personal information, it is inclusive of health information. But because we have legislation that is very specific to health and health data and what we do with health data, we also have an even more in-depth definition of personal health information. And that we get right into the nitty-gritties of that. And so, family history and genetic information and personal health card numbers and all of these pieces. Okay, so we're just zipping through this. Okay, so personal health information in health research. So this is, I guess, the crux of the matter here today and what we want to talk about. And really, it all comes down to this. There's all kinds of types of research. There's all kinds. And I just, seriously, I know I've missed something really important, but I thought, okay, when you think medical research, what do you think? You think about experiments. We always see that, the person with the lab coat and the test tubes. We have clinical research, clinical trials. We're familiar with that. You might have maybe case studies or observational studies. We have epidemiology, and this is when researchers are looking at large cohorts or large populations and looking for trends. And then we have reviews. We have sort of secondary data where we might be looking at other sources to look for patterns in there. So regardless, no matter what we're doing, we're using health information. Like if you are doing health research, you are using health information, you are using personal health information about folks, whether that's lab work. This could be you've got biosamples. It could be, you're collecting from people, whether you're doing survey work, maybe you're doing an interview, one-on-one discussions with folks. You might be using scientific texts and pulling out cohort information from various places to pull it together. Or you might be using large data sets, which is often, many of us here, that's the kind of research work that we're talking about. So how do we practice privacy when we're in this kind of environment? Regardless of the information, if it is personal information, identifiable information, it has to be protected, okay? It's not optional. So all of these things I'm talking about are not nice to haves. These are requirements. So the fair information principles have to be followed, the legislation, the applicable policies, and its accountability has to be there. And we do accountability through, we talked about having peer review, and community review would be amazing. That would be just amazing. Having that approval before you can go ahead. And I'm saying it this way because I want folks to have that reassurance that if you are participating in health research, these mechanisms must be in place, okay? This is something that has to be there. And consent needs to be granted. And when I'm talking about consent here, I'm talking about informed consent. I'm not talking about that click, just to get in to see the movie. I am talking about research study details have to be provided to you, what information is being collected, how it would be, that should say how it would be protected through the whole life cycle, how will this information be used. These, you have a right to know, and this is users' rights, like our participants' rights. So, do you have to stay in the study? Can you leave the study? If you don't like, kind of thing, what's going on, when can you drop out? These are all really important things. So it comes back to administrative data. So I had a poll here, we're gonna skip the poll, and the poll was, when might consent have to be waived, and it's for administrative data. And the reason it's waived, just really quick here, information, administrative data, I won't go into it, but I think it's been explained really well before, that it's the data about our life stories. It's our birth, it's our education, it's health, it's social services, it's our death, it's any interaction we have with government bodies for service. Administrative data is being collected for us. So when we enroll in school, when we go to get our COVID shots, all of these things, information about us is being collected. And so why would we, if we want to have access to this massive, amounts of data, it's not always going to be practical to stop and ask for consent. So, what requirements are in place to waive consent? It is not a free-for-all. It is not, a simple task. Access is granted only under very specific conditions, and these conditions are listed often in legislation. Most provinces and territories, it actually states the conditions when there will be a waiver of consent. And it will be de-identified. Okay, you cannot have unique identifiers. So that means no name, no specific Medicare information. It means illegal agreements are in place for sharing and accessing that data. So that means there's an agreement between the regional health authority that gave the data to the researcher or to the research center that's providing access, and that says this is how it will be used. The data must be accessed in a secure research environment. These are the research data centers. These are members of the Health Data Research Network of Canada. That's what we do. We provide that secure access. The data must have approval by a recognized review body, okay, so that the data access. And they're not just looking for it's inconvenient, they're looking for it is truly impractical, it is not possible to get. So think about it, maybe your population you're studying have all passed, right? You know, these are things to consider. All right, so just to skip on home here, the importance of administrative data, why would we want this waiver to happen? There's just so much value in that data, and it covers long periods of time. Like, if you want to do a 20-year study, how long does it take? It takes 20 years, right? It's a lot of money, it's a lot of time, it's a lot of investment, and that's not always, we need answers, you know, to affect policy, to help make health decisions. So we're able to, if we access administrative data, we can look retrospectively at, you know, a cohort and see what's happened. We have data sets that represent whole populations, and I'm really regretting putting this in this slide right now because of some of the discussion today, but my intentions were good. You know, we want to include as many folks as possible. And even like when you're doing data and you're doing primary data collection, you can't get to everybody. Children are really hard to include. The very old are very hard to include. People who live on the fringe of communities, you know, it's hard to always have them in your health studies, but their administrative data can be available. And then finally, we have a right to participate, and this goes back to me and my human rights here. We have a right to participate and benefit from science as individuals. So that's always there. And the way to do this, the way for us to protect our privacy is to ask questions. When you get an opportunity to participate in health research or engage in an opportunity, ask questions. Ask questions about privacy. What are they doing to protect privacy? How are they handling data? Some of the discussions today have been fantastic. Consult resources in your region. You have an ombudsman, you have a privacy office, you have even the Office of the Privacy Commissioner of Canada has some amazing resources. There's our Privacy Day every day in January, lots of events around that. There's lots to make aware. And finally, the public and patient partner opportunities. This is one of the best ways to make sure that your privacy is protected in research is to engage, to have your voice, to be part of just participating in this event. You know, you're engaging and you're making yourself aware. So, there we go. Slid there right in on time.
Thank you for that, Donna. Again, if anyone has any questions in the room, please raise your hand. Or anybody online, if you want to put your questions into Slido, they will be shared in the room. So any questions for Donna on that excellent presentation? Oh my goodness, we've got 3 hands up already. I think Louise was first.
There's been controversy that's starting to Gabby Stevens and written some things about anonymized data that organizations are selling, and we have not given consent for them to, we've given consent to anonymize, but not to sell our data. And there's a lot of controversy now that we should somehow get the money from that sale if they're going to sell our data. How we'll do that is beyond my understanding, but it's really becoming, it's becoming, as I like to say, it's becoming a thing.
Mm-hmm. And I really don't have a response, but why, if it's ours, you know, I really truly believe that, you know, that your personal information, your personal health is yours, and you should have autonomy over it. So it's alarming, you know. Yeah, interesting though, very interesting, Louise. Hi.
I come from a research background, and it's usually the case that people are very worried about privacy and they don't want to share data at all sometimes. Although privacy officers say it's okay to share data in this context, but it often comes down to having to talk with someone like you who knows what, like, the ins and outs of this. My question is there a resource that we can all access where we can clearly say, it is okay to share like this under this context? Because most people are very concerned to break like the law, the legislation, the regulation, or the standard.
That's a good question. At one point of, you know, to go to, no, but there are resources. So you're in the research. That's a really good question. I know if you're working, are you working with HDRN Canada? Are you involved in any of the research data centers that way, or?
No, I work with RTC.
Oh, StatsCan, okay.
Or work with
Okay. Oh, okay. So there is a privacy officer there. Yeah. So, and that's, you can point folks. I am very fortunate to be part of the Health Data Research Network privacy team, and there are folks like me across the country. I hope they're online today. These are privacy professionals, and I know for Pop Data BC has a wonderful privacy professional that works there, but I know what you're saying. Like, how do you're in front of a participant in a study. How do you build that reassurance, that trust, that sharing their personal information? And I think it's just education over time, and more. And I mean, that's kind of a simple answer for a very complex issue, but I think we just have to keep engaging and raising awareness about data and how we protect data, and that is giving that assurance about respect for the data. You have a follow-up? Yeah.
I think Geeta's standing at the back.
Not so much participants, but stakeholders. Sometimes governments, they have data, but they are worried to link it, for instance.
Pardon me? Can you say?
Like, say, local governments, for instance, like in our example, the city of Vancouver has like particular data that will be useful for health research, but they think that they are not supposed to share anything, even though under these principles, it's reasonable. So
the participants don't think, or the government doesn't think? The staker, yeah, they don't think they should share it. Yeah, we know. Yes, so this is an issue. Like, how do you, and this is the thing, they don't follow their own mechanisms that are in place. How do we get them to interpret legislation to stop being this whole, black and white, that you must or you must not do something, kind of thing. Like, how do we give them to act more as stewards, to share the responsibility? And I think that's a really important, and I actually think that's initiatives that are happening in Canada right now around data sharing and trying to build up that culture of stewardship. Yeah, that's a really good point.
We have a question on the Slido. Do you want to read the top one?
Yeah, how do you protect privacy of data in a rare disease health research? For example, if the population is very small. Yes. Okay, so this is a question that many of us in the room are dealing with all the time, because we live in communities, I'm pointing to my colleagues from PEI, I'm from New Brunswick, we have colleagues from Nova Scotia. We have very small populations, we have the territories, we have Yukon, this comes up all the time. And how we're going to get through this is we have to work together. We have to find mechanisms that we can pull data together. And I'm not saying pooling data, at an identifiable level is the only answer here. I'm saying there are many options that we need to start looking at legislation and finding ways to share, maybe like the 4 Atlantic provinces working together to represent a rare population, or a small population for a rare disease through Atlantic Canada. Like, can we put mechanisms in place to do that? There has to be a way to navigate legislation that has been, to this point, not allowing us to share data in a way that's meaningful. Yeah, it's a really good question.
I think Carrie-Anne has a question at the back.
Carrie-Anne?
Hi,
Carrie-Anne.
Thank you so much, Donna, for your amazing presentation. And it's funny, it actually kind of ties into the second question here that's on the board, but I was just wondering, with like new technologies, social media, and all these things, how is legislation evolving to accommodate the risks that are associated with that technology? And maybe to tie into the second question here on the board is, like, how do you build that consent process to shift to mindful consent instead of just a click?
Yeah, yeah. And actually, and I was sort of joking about the legislation changes coming in Canada, and what's happening is there's going to be, from one piece of legislation, there's going to be 3 new pieces of legislation, and I won't break it all down to, it's not a law class here, but the point is that it is so complex, and this is, and I think what we can do as individuals is to build our own mindfulness, to be aware of our own personal information. The legislation has a lot of, the reason it hasn't gone through is it just can't get past committee. There's just so much pushback on it about it's not robust enough, it doesn't do enough, it doesn't address enough, and it can't keep up with the changes in technology. But we have to start somewhere, or we're just never going to move forward. So, and I think this is where some of this whole mindless click is, don't do the mindless click. You know, like, ask yourself, like, we were talking about this just yesterday. There's apps that we want, and it starts asking me for all my personal information. Do I really need this app? You know, do I have? No. So it's making some choices for ourselves. But the legislation, you know, ideally would be more, you know, robust, but that's a terrible answer, I know, but it just, you know, but, okay. Do you want me to read, is there?
Just read the last one, then Craig will have to stop after that. The last one's a comment.
Okay. Not a question, but a comment regarding collection. Consent implies understanding the information as presented, and that the consent offers a comprehensive explanation of the data life cycle. Yes, that's ideal consent. The whole life cycle's been addressed. Yeah. Oh, okay, we've got.
We'll squeeze one
What's
more
squeezing in?
I'm scowled at, but we'll squeeze you in.
So I'm not as familiar with how persistent this problem might be in research, but certainly as it relates to the level of care, it's something that patient groups and citizen groups hear about a lot, which is you know, the 2 fair information principles that you shared around access and accuracy. I mean, these are challenged regularly. You know, people wanting to access their own health information, maybe it's hard copy, digital, whatever the case may be, but certainly on the hard copy side, it can take a long time and it can cost a lot of money, prohibitively so, and sometimes they go to privacy commissioners and that can get mitigated or not. And accuracy, I mean, it was just shared by Elise at the last meeting where, you know, people sometimes give up trying to correct errors in their record, some of them really quite fundamental. And I just, any commentary on opportunities to better engage on a couple of those fundamental principles within the current systems we have.
Yeah, I think that a couple things just really quickly come to mind is, what are we collecting for? Like, and I think that's something I really believe we over-collect. And I think that sometimes we don't always need to have all the information that we're asking folks for, and that would certainly mitigate one of the situations. Like, what is it that we're asking their information for? Like, what's the purpose? Really defining that, I think that would help as well. And then the other piece behind that is just, you know, I've lost my thought. I was so excited. So. We're just going to leave it at that. So, but what you're saying is extremely important, like, because it's such a burden on, like, a small not-for-profit. How do they respond to a data access request? Like they just don't have the resources. It's off the side of somebody's desk. And I think if we reduce collection, we collect for a purpose, that is one start.